Hey everyone, my name is Dr. Asma Zafar and today's topic of discussion is oral cancer treatment, options and management. Oral cancer is a serious condition that necessitates a multifaceted approach to treatment and management. The choice of treatment depends on various factors including the type and stage of cancer, its location and patient's overall health. So today we will discuss the primary treatment options available for oral cancer as well as management strategies to enhance patients' quality of life. The first option that we have is surgical treatment. Surgery is often the first line of treatment for oral cancer, particularly in the early stages. The main objective of surgical intervention are to remove the tumor and any affected surrounding tissues. Tumor resection. This involves the removal of primary tumor along with the margin of healthy tissue to ensure a complete excision. Then we have neck dissection. If cancer has spread to the lymph nodes, a neck dissection may be performed to remove affected lymph nodes and assess the extent of cancer spread. We also have reconstructive surgery. So after the removal of the tumor, reconstructive surgery may be necessary to restore the function and appearance. This can involve grafting tissue from other parts of the body to reconstruct the oral cavity. The second option that we have for treating cancer is radiation therapy. Radiation therapy uses high energy rays to target and kill cancer cells. It can be used as a primary treatment or as an adjunct to surgery. External beam radiation, which is the most common form of radiation therapy, where a machine directs radiation beams at the tumor from outside the body. And then there is palliative radiation. In advanced cases, radiation may be used to relieve symptoms such as pain or difficulty swallowing. Then there comes the chemotherapy, which is the third option that we have to treat the cancers. Chemotherapy involves use of drugs to kill cancer cells or stop their growth. It is often used in conjunction with surgery or radiation therapy, especially for advanced and metastatic oral cancers. Then we have systemic chemotherapy. This treatment is administered orally or IV, allowing for drugs to circulate throughout the body. So we also have targeted therapies. There are some newer chemotherapy drugs that specifically target cancer cells with fewer side effects on normal cells. These therapies are often used for specific types of oral cancers, such as those associated with HPV. Now, the fourth option that we have for treating cancer is immunotherapy. Immunotherapy is an emerging treatment option that helps the body immune system recognize and attack cancer cells. This approach is particularly promising for certain types of oral cancer. So a system called checkpoint inhibitors, these drugs block proteins that prevent the immune system from attacking cancer cells, thereby enhancing the body's immune response against the tumor. Then there are monoclonal antibodies. The monoclonal antibodies are lab-made molecules that can bind to specific targets on cancer cells, marking them for destruction by the immune system. And then there is very important part of the cancer treatment, which is supportive care and management strategies. So we always require management strategies in order to deal with cancers. Supportive care is crucial for managing symptoms and improving the quality of life for patients with oral cancers. A very important part of treating and managing oral cancer is the pain management. Effective pain control is essential, and this may involve medications, physical therapy, alternative therapies such as acupuncture. Another very important requirement is nutritional support. So patients may experience difficulty eating due to pain and changes in taste. So nutritional counseling or dietary modifications can help to maintain adequate nutrition. The patient might have problem with speech and swallowing, so speech and swallowing therapy can be taken. The patient may also require psychosocial support. Counseling and support groups can help patients cope with the emotional and psychosocial challenges of cancer diagnosis. To conclude, the treatment and management of oral cancer requires a comprehensive and individualized approach. Surgical intervention, radiation therapy, chemotherapy, and immunotherapy are the primary treatment options, each tailored to specific needs of the patient. Additionally, supportive care plays a vital role in enhancing the quality of life and managing symptoms, including a multidisciplinary team, including oncologists, surgeons, nutritionists, and mental health professionals, is essential for providing holistic care to patients with oral cancer. Early detection and timely intervention remain crucial for improving outcomes and survival rates. If you or someone you know is facing oral cancer, it is important to consult with healthcare professionals to explore the best treatment options that are available. Thank you so much. That was it for today. See you in my next video.